Healthwatch Kirklees. Welcome to my world. Issues affecting people in Kirklees who are deaf and hard of hearing as they interact with health services. During the summer of 2013, several people with hearing impairments approached Healthwatch Kirklees to talk about their mixed experiences when using health services such as GPs and hospitals. Because Healthwatch Kirklees is the consumer champion for health and social care services, they were concerned that some of the other 6,000 people with hearing impairments in Kirklees might be experiencing problems too, and decided to investigate this further. Healthwatch Kirklees held focus groups with 50 people with hearing impairments during November 2013 and received around 410 completed online and free post surveys. Of the people who responded, just over 35% described themselves as deaf, 26% as hard of hearing, and 72% said they wear hearing aids. The people who responded to the survey or attended the focus groups explained that problems occur at several different stages in treatment process. Contacting the GP surgery or hospital. Most GP and hospital appointments are made over the phone. This can be very difficult for people with a hearing impairment. 39.5% of the people we asked said they felt they could call for an appointment themselves, but 39% rely on friends and family to call, and 48% have at some point visited in person to book an appointment, which isn't always convenient. Although many people were content to continue booking appointments in this way, around 25% of people would like to contact their surgery by email or text. Of the people asked, over 50% did not know whether their impairment is recorded on the GP or hospital systems, so were unsure whether staff would be prompted to make adjustments for their needs, such as booking a BSL interpreter or passing on details of hearing impairments in referrals. Many respondents said that reception staff lacked awareness of the needs of hearing impaired people. At the reception in the waiting area. At the surgery, there was an even split between patients being verbally called into an appointment, 44%, or where there is a visual display screen, 44%. 21% said the nurse or GP collects them. At the hospital, the majority of people are verbally called in, 59%, with 25% collected by the nurse or doctor. Verbal calling has led to some respondents missing appointments because they didn't hear someone calling for them. It can be especially difficult in waiting rooms where a TV or radio is on. Worryingly, some people experience difficulties with staff and the environment in the waiting room at the Huddersfield Royal Infirmary, HRI, Audiology Clinic, a department that should be demonstrating good practice in deaf awareness. During the consultation, patients with hearing impairments are concerned about missing important information about health conditions and medications because the doctor or nurse doesn't communicate clearly with them. Key problems are medical staff not speaking clearly or not facing the patient. Concern about misunderstanding had led some people to ask a family member to interpret for them at appointments, but they felt this was inappropriate. Some had resorted to researching online when they got home. Some medical staff have written things down for patients with hearing impairments, but staff don't seem to understand that deaf people don't always find written English easy to understand. Some respondents told us that they had bad experiences with poor BSL interpreters, predominantly those provided for appointments at Huddersfield Royal Infirmary. The interpreters weren't always gender appropriate, with male interpreters being sent to gynecology appointments. Access to other NHS services. The survey found that, of the 139 people who had communication problems with other NHS service, 60% struggled at opticians, 59% at the dentist, 34% with pharmacies, 30% had problems accessing the NHS 111 service, and 29% had problems with community healthcare services. People felt that these providers were not deaf aware and didn't make adjustments to allow deaf people to access their services. Deaf people are not aware of their rights as consumers of other NHS services, especially specialist services such as maternity or emergency services. A number of comments were made about the difficulties presented by travel to hospitals for hearing aid aftercare, such as battery replacement, etc. Recommendations. After listening to the concerns of people with hearing impairments, Healthwatch Kirklees felt they should make some recommendations to providers and commissioners to help them improve the way they deliver their services. They asked that all NHS and social care commissioners introduce and advertise a text, email, or online appointment booking system. Develop and promote deaf awareness training to all staff. Enhance recording systems to flag up communication needs. Send confirmation and details of BSL interpreter booking to patient. Use online BSL translation service in emergency situations. Take on board the feedback of Children's Hearing Services Working Group. Install and appropriately use induction loops in NHS buildings. Raise awareness of consumer rights for deaf people. Raise awareness of 999 emergency service registration system. They asked GPs and hospital trusts to install visual display screens or ask staff to approach and personally escort people into appointments. Ensure that choose and book appointments at GP surgeries meet the communication needs of the individual, and that GPs notify the hospital in their referral that a BSL interpreter is needed. Recruit a deaf or hard of hearing liaison worker at the hospitals. They asked NHS 111 to make suitable adaptations to the service to ensure it is fully accessible, text or video conference. And they asked the Health and Wellbeing Board to fund localised hearing aid aftercare services. Healthwatch Kirklees have sent these recommendations to all stakeholders and providers, and have asked for their commitment to making changes. They are waiting for each organisation to come back to them to explain what they have put in place. If you have any other comments you would like to make about your experience of using health and social care services, please get in touch with Healthwatch Kirklees. Website www.healthwatch.co.uk healthwatchkirklees.co.uk. Email info@healthwatchkirklees.co.uk. Postal address Free Post RTEY-JSBE-ZUGU Healthwatch Kirklees, Unit 11 to 12, Empire House, Wakefield Road, Dewsbury, WF12 8DJ. Telephone 01924 450 379. Healthwatch Kirklees.